you can all hear me and hopefully you can all see me. And so 2 seconds, just as I get this sorted, hang on a moment.
You are a co-host, so you will be able to share.
So can you all see my screen or not yet?
Not yet.
Okay, hang on a second then. Let me escape from my presentation view and then go to screen sharing view. I'm sorry, I've been using Teams for ages and then you get into a point where, here we go. So I want to share. Bring me both. Okay, 2 seconds. Can you see my screen?
No, you may
Not yet. Not yet. No.
Okay.
Press the green button at the bottom of Zoom, which says shared.
Yeah, so hang on 2 seconds. So that it's asking me which, it asked me which screen I want to share. Let me try that one. Screen 1, please. Share.
Hey.
You can see this screen, yeah?
Gotcha.
This one?
Yep, all good.
Okay, so this wasn't quite how I wanted it to look. So I wanted it to look like a beautiful slideshow. So hang on a second, which now sits up there. I can't move that down there. So I need to share screen 2. This is getting on my nerves. So 2 seconds. I'm going to stop sharing and I've got it now. Share screen, screen 2, share. Let me start from here. Better? Yeah?
Yep, it's just in the middle of the screen now.
Okay, I need to go back to that one though. Why can't I go back to that slide? So can you see the open science screen with me speaking at the bottom?
Yep. Yeah.
Yes.
Nice and clear.
Fantastic. For some reason, I can't seem to get back to my first slide, but I won't worry too much about that at the moment. There we go. Okay, if I do that, brilliant. Okay. Wow, sorry that took quite so hideously long. Okay, so that's what happens when you move from different types of things. I've also put the subtitles up. So just in case I ramble on randomly, you can also see what I'm saying as well as read the slides as well. So thank you so much for having me back. I'm actually really excited to see you all again. Because actually we can't do any of this or any research without you. So this is the process really involves you. The process relies on you and the process is about you and it's for you. So therefore, actually you are more than an integral part of it. You are the research. This is what it's all about. So, and actually, I'm really, really keen that we work with you and you work with us to actually lead and shape the research questions of the future. And I hope you're kind of with me on that trajectory of joining together. So I just wanted to kind of talk about open science. I was talking to Catherine a little bit about open science. It's kind of the sort of the theory of kind of collective thinking, but collective thinking kind of in a public sphere. Sometimes it's called citizen science. So it's about theory, it's about ideas generation, but the ideas perhaps come from you, not from me. So you're setting your own priorities and asking us to come and kind of deliver the work that you think is important rather than the ideas that we think are important and bringing them to you. Does that make sense? And also, when we all work together collectively, we produce a different sort of knowledge and it's often greater than some of its parts. So I quite like that quote. So why? Whoa, this is a big scary slide. Why do we need transparency in research? I'm sure you all understand like the concept of transparency, that you can see every single part of the process. So often we kind of bring people into bits of it, and transparency important. Let me use an example. The COVID vaccine. Let's take that as an example. A very, very poignant example that's actually in our press at the moment. Actually, we're somehow doubting the quality and integrity of the vaccine. Why? Well, it was because actually we've only been given certain parts of the pie. We've only been fed through the media certain bits of it. And then there's been some kind of some pushback to say, actually, this bit was done too quickly. And then there's been debates which have been really open. So we've seen bits of the open science, but we've not seen all of the open science, which means that it's like creating doubt, because what we don't understand is the actual research process that's gone on to develop something really, really challenging like a vaccine. So open science actually breeds quality and integrity because people can see what's happening at all the stages in all the process. It does have some economic benefits. It certainly has global benefits. That can be about sharing data, about sharing work, about sharing resources, which is one of the positive things about COVID. there's very not positive things about COVID, is that people work together globally to share resources and data, which meant that most people were able to develop things quicker and get things to people on a more global scale. And this bit here is quite important. So public disclosure and engagement. It's publicly funded. Research is publicly funded. So it's for you, it's about you, it's funded by you. So actually, you should have much more of a say in what we do and kind of steer our directions. And actually, it doesn't only just build public trust, but it kind of builds like a kind of a societal push to get behind it and support it and look at it and work alongside and with us. So and actually some of the innovations that we think about in open science, they don't always come from us, because we're not, well, if I speak about long-term conditions particularly, or health and illness, we're not living and breathing that illness. We're not suffering on a day-to-day basis. We don't have that in-person understanding and that depth of knowledge that you have when you are experiencing something. And often that's why kind of the most innovative ideas don't come from us, they come from you. Okay, so I want to talk about how kind of research works here and now with me and kind of the health sciences team, so as you can understand the process that we go through. This is quite sort of slimmed down. See if this works. Okay, so we kind of have an idea phase where normally the researcher comes up with an idea, and it should be an idea that's born from the clinical practice or from people or patients. There's a conceptual phase. So you take your idea and you kind of think, actually, how do I frame this? How do I make this into a question or a thing? How do I develop this into kind of something that makes sense? So you're conceptualizing your idea. The design and planning phase. So now I've got my kind of framework, my idea, how it fits in the real world. How am I going to make this into a project where I answer my questions? I've come up with some ideas and some questions. How do I answer them? How do I think of the right sort of methods and the right sort of process that's going to successfully answer that question? And what sort of answers do I want to find? Do I just want numbers? Do I want more depth? Do I want people to, do I want to kind of what we call like elucidate people's voices and understand how things work? And then we get to the empirical phase, which is the doing phase. That's when we actually do and deliver, collect data, talk to people, take biological samples, actually find things out. There's lots of issues about data storage, looking after people, caring for people in this phase. This is the development phase. Then we have a great massive database full of numbers, words, data, interesting insights, biological samples. And we get to the analytical phase. That's working out what it all means. How do we process that? Who do we get to help us process that? Who should be helping us look at that data? How do our findings kind of relate to other people's findings? How do they relate to kind of the real world, which is also real? And how do we kind of set them in context? So going back to what the question was, have we answered that question? And then we get to the dissemination phase, which is, we've got some findings, they answer this question, we found something out, let's go tell people about it. Okay, so where do you come in? We often go, quick, we need your help about here. We've already thought of an idea in a conceptual phase, we've already kind of put it into context, and we need your support to design and plan it, mainly because we don't get any money to do it if you don't help us. And this is not how it should be. So that's the process. Actually, there's a large focus on PPI, which is the public and your input, when we're at the empirical phase, because NHS ethics demands that of us, the HRA, the Health Research Authority, and the data compliance and safety. They're all really key, and we shouldn't be touching people, poking people, asking people questions in the empirical phase without being really clear about what our objectives are and what we're doing. And that's why that phase is this phase, the empirical phase and the design and planning phase, is often where your support and input is really focused. Number one, for safety, and number two, because actually it needs that review to make sure that it's feasible, so as people will offer some money, which is not too. But I would really quite like to see PPI here. Sorry, the arrow went wrong, and here. Because wouldn't it be amazing if actually we were taking your ideas forward, we were supporting the development here, we were actually involving, and not just involving, but the public were driving some of the analysis and linking it back to those questions that they originally came up with. And furthermore, we're kind of promoting and taking the work forward and going, actually, we've been part of finding this stuff out, and actually we want to share this. I hope you share my vision in this. So one of the things that I came back to tell you is what's happened to all the things you did for me in April. So in April, I presented, thank you, and you listened, thank you. And I was trying to go to apply for funding to a large funding body called the NIHR. That's the National Institute for Health Research. And they're a big funder. And they were also at the time working with the UKRI, another very, very big funder. And we were putting together as a national group of respiratory nurses a qualitative exploration of the experience of respiratory nurses working in the COVID-19 pandemic. And you kindly went through that study in quite a lot of detail. And we put in quite a well worked up bid, but the NIHR, very competitive. So sadly, we were unsuccessful in that bid, mainly because the feedback was that it didn't meet the broader public health needs that they were looking to fund. It was very focused on the nursing voice and nursing experiences. So we went to, because of that feedback, we took the same kind of application, we changed it slightly, and we went to the Burdett Trust for Nurses, another funder specifically for nurses. They kind of have sat on that application for quite a long time, and they haven't given us any feedback at all. You kind of, when you're applying for funding, when you've waited that long, since kind of June, we're thinking we're unsuccessful. However, we didn't just sit there and wait for this study to be funded. We thought we'd also, at the same time that we're developing our kind of qualitative exploration of the diary work, we put together an online survey, because it's something that we felt we could deliver in an unfunded way because it didn't take up too much of our time. And although I was working on the kind of the qualitative diary part of it, my colleague in Glasgow, well, we all wrote the survey, but she kindly put it out. So we put out the unfunded survey, and you'll never guess what? It was hugely popular, and we've literally, which is quite a nice time to come to this meeting presented to you, we've literally just published this paper. Well, we published it on the 4th of November, it was accepted, but I think it might be in your newspapers today. So you were right in telling me that it was still an important topic, and that guidance gave us the confidence to pursue it even in a smaller way and an unfunded way, because it seems to be, it's very important to the public. So as much as it wasn't very important to the funders, the newspapers, the public eye, Twitter, all those sort of people have said, actually, this is important. We need to look after our staff and our nurses, and we don't hear enough about the nursing voice working in respiratory areas. So you were right, which was really interesting. So I think it might be, it's in the Dorset Evening Echo, I've noticed. So it's always combined slimmed down. So there you go. That's what your help did for us. It helped us to have the confidence to pursue something. So thank you. So can we do more? So you guys have been fantastic, and you've been innovative, and you've set up this exceptionally cool coffee morning, which was absolutely vital to be able to come and talk to you in this way and to be able to get immediate feedback, which was so helpful during the pandemic. However, I found this amazing slide, which is all of the other things that we could possibly do together. So you could offer one-to-one consultancy, you could do interviews, and we kind of reduce those sorts of things. You could review them, you could be part of them, but you could kind of also do things like citizens' juries, you could do like open panels, you could hold public meetings to disseminate research with us. You could set up your own opinion polls. You could have like a public drop-in space. The world is your oyster. These are really cool things that you could do. And I just want to reiterate that point. The public are so vital. You are so vital for every stage of the process. And we need to recognise that, involve you in as many, and provide really open opportunities for you to work with us to work with you in many, many different ways. Okay, so that's me waffling on about how amazing you are. Let's just, today, I've got another favour to ask you all. I hope that's okay. I'm kind of using you as a bit of a focus group because I am trying to, well, I've written a paper, which is the last paper from my thesis. And my thesis is finished, and that last paper kind of ties into a larger body of work that I'd like to do, which you looked at, I think, the last time I dropped in, which was looking at how people weave and enact self-management support and how they kind of bring it into their lives. So it's a little bit of a strange theory paper, but I'd quite like to get some of your feedback on some of the findings in the paper, if that's okay. So you're supporting my analytical stage of my research. So I have already read the literature. I've performed something called a qualitative metasynthesis, which I will explain. I've pulled out some of the what we call the second order themes and the third order themes, and I'll explain those to you, don't panic. And actually I'm just going to present those to you and ask you 3 questions about them. So you're supporting me with analysing my findings, if that's okay. Hopefully this will be okay. Okay, don't worry, there's time to look at these, okay? So these are something, so I'll put this up a second. So the way that I've meant to put in a slide in about how I do qualitative metasynthesis, so I will just explain that really quickly. What happens is I do a search of all the literature, a really huge search, and try and find as many papers on the subject that I wanted to, which was, again, looking at people with COPD, a long-term respiratory condition, and trying to understand, and then looking very specifically for all those papers that talk about how people not just manage themselves, but how people feel about managing themselves and how important it is for them to manage themselves and what they value about managing themselves. And I specifically chose papers that address that issue, and there wasn't that many. There was about 5 of those papers. I then combine all of the findings of those 5 papers into one big heap, and I pull out what I call the interpretations. They're the interpretations of me combining the findings from 5 papers. And these are the combinations that I found, okay? So that self-management, these are the themes: self-management, accountability, and personal responsibility. This is something that came through in all 5 papers. The value of positive engagement with healthcare professionals when self-management support is relevant. So people value the time they spent with healthcare professionals, talking to them specifically about self-management support. This is about concepts of personal responsibility and who is accountable for delivering their self-management and understanding their self-management. Excuse me. This is how people through all the papers develop a personal understanding of illness through shared and personal experiences. So really interestingly, people's understanding of their illness is not always from what we as healthcare professionals tell them. People understand their illness through how they experience it, and also how other people around them experience the similar illness. And everyone in the paper recognised the value of social network support and personal choice. And and they're all people with COPD in these papers. And these 4 categories help me to understand why people with COPD engage in self-management and how they embed these activities into their lives. So these are the 4 themes that came out of the 5 papers, that actually that there's some issues around accountability and responsibility, that people have understand their illness in a way that we didn't think they did, that actually it's through experience and through the experiences of others, that the social support and personal choice is really important, and they value positive engagements. That means things like active listening and listening to people's own values when we talk about self-management support. So I'll leave that slide there for a second. I can go back to it if you need me to. So I don't know how you want to gather this feedback, Catherine, but these questions come up twice. So I don't know if you want to write down some answers and give them to Catherine, or I don't know if you want to shout out and discuss it with me, but these are just like a flavour from you, really. Do these findings feel real? Can you relate them to people with long-term conditions? Do you think that's how people really feel? Number 2, do you think they're a fair representation of people with a long-term respiratory condition, in your opinion? And number 3, is there a point of one of these findings that you're uncertain about, or doesn't fit with your thinking, or you would like to discuss?
Okay, I think thinking about sort of what people are going to say. We will have to stop the recording as if people are going to start sort of having. Lindsay, if